Hi everyone, welcome to researchmd.com. And today we're going to have a morning report discussion and let's start. Okay?
There's a 67-year-old female
67-year-old female.
who presented to the emergency room for with her left hand pain, redness and swelling.
Okay, so we got a 67-year-old
Yes.
patient come with left hand pain and swelling.
Yes.
Okay, anything, every time when I say like, what is the emergency right here, right? That's my first question before I start. What are the emergencies on this situation like this? Somebody come with the left arm pain and swelling, what are the emergencies? Come on.
So
Infection.
maybe
What infection like? I mean, you have to be very specific. Don't give me like a broad, I mean, what could kill the patient in 45 minutes? Anything when you have left hand pain and swelling, what could kill?
MI?
Could be, yeah. Sometimes this is like atypical presentation.
Yes.
Good thought, I would say, like maybe the pain ready in the shoulder could have an MI. What else? Kind of related to that. So, I mean, I give you a little bit of credit for that. What else could like somebody with the left arm pain and swelling? It wouldn't like MI, does it cause swelling?
No.
No. Maybe like shooting kind of pain
Yes.
towards that. You have to be kind of careful.
Necrotizing
But sometimes they
fasciitis.
feel heaviness. So I'll give you a little bit more credit. What else?
Necrotizing fasciitis.
Necrotizing fasciitis, that's what I'm looking for,
Mm.
right? People, if you miss that, what's going to happen to the patient? They will be dead in 30, 45 minutes. Either they lose their leg or there are a report like that. I think I remember a case, there was a patient had like a shoulder infection, half an hour he was dead. Okay, so it's very, very important you have to see, does this patient have necrotizing fasciitis? So what are we looking for? Like what are the signs and symptoms of necrotizing fasciitis? What are the signs and symptoms of? How do you know? Like, I mean, this
Fever,
patient coming
warmth.
and he got a cellulitis. How do you know this is not necrotizing fasciitis?
Fever.
Warmth, crepitus.
Crepitus is going to be the pain out of proportion of the presentation, right? Pain out of presentation. There's usually like a bullous lesion, rapidly spreading and violaceous lesion. And those kind of things kind of tell us. And of course, when you touch it, you can have like crepitation, okay? One main thing is the pain out of proportion, right? Bullous lesion next to the lesion. And then rapidly spreading and the redness kind of going above it, and there's like crepitance. Those are the things like you have to look and a lot of times also you can get like a loss of sensation also. Okay, so those kind of things kind of very important for us to come with to rule out necrotizing fasciitis. What else can you do? Like a risk? Is there like a risk assessment tool you can use? There's a scoring called LRNEIC, and you can put all of this information. Like I think they ask the white count, the presentation, and then if the score is greater than 6, so you can pretty much say this patient is high risk for necrotizing fasciitis. And then you need to like, so what do you do with necrotizing fasciitis? What is what is the next step? Say you think necrotizing fasciitis, what would you do next? Come on.
Culture? Sorry.
Come on. What is it like? The culture is going to save the patient right
No,
now?
like empirical antibiotics.
You need to start like what kind of like, you need to cover the anaerobic and all those kind
Yes.
of thing, right? Those kind of thing. What else?
Amputation.
Surgery, okay. No, you don't amputation? No, we don't want to amputate somebody right there, right? We want to call surgery and do the debridement and cleaning up the fascia and all that. So, and also you need to cover for this gas organism, gas gangrene organism, right? Those kind of things kind of. So antibiotic is a bigger role in it, but the first number one priority is always called surgery, okay? Very, very important. Right? You got it? So, anytime somebody with pain, swelling, and you think it's cellulitis, my mind is what? Necrotizing fasciitis. Then I need to know all the clinical presentation of necrotizing fasciitis. What are the other emergencies? Compartment syndrome is an emergency?
Yes.
Yes.
Okay. So, what are the symptoms of compartment syndrome usually?
There are 5 P's. So
Okay,
that's
what are
like,
the, tell me about 5 P's. Somebody tell me about the 5 P's.
pain,
Louder.
pain, pallor.
Okay. Pain, pallor,
Paresthesia.
paresthesia,
Pulselessness.
pulselessness,
Pressure, increased
pressure.
pressure.
Those 5
Yes.
things kind of tell us, what do you do when you're suspecting a compartment syndrome? What do you do? Again, who do you have to call?
Surgery.
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 Okay. These are the kind of things, if you don't call surgery, they might lose their arm and all that. Necrotizing fasciitis, they spread through fascia so fast. I think it's like around 0.5 centimeter per hour or something like that, and boom, you're gone pretty much fast. Okay, so those are the emergencies you need. Now let's look at our differential diagnosis, right? We'll say like infections, right? When we talk about, I'm going to put the differential diagnosis of the left arm swelling. We can say compartment syndrome, right?
Mm-hmm.
Compartment syndrome. What are the other things we can say? Maybe vascular occlusion, right? Vascular occlusions like DVT. And then what else? Trauma,
Trauma.
right?
Yeah.
Trauma can, somebody fell down. And then of course there is like malignancy, right? Malignancy also, right?
Yes.
So when you talk about so these are the broad differential diagnoses, right? So infection mainly, we need to worry about what?
Cellular.
Like necrotising fasciitis, what is the what is the most common organism in some soft tissue infection? What we have to worry about more? What are the things we have to worry about more? Tell me, like MRSA infection, right? I need to be
yes.
very careful about that, right? So how do you treat MRSA?
Vancomycin.
Vancomycin. Let's say you have a patient on the floor. You're doing outpatient practice and you wanted to treat with MRSA infection, right? Which antibiotic, which oral antibiotic you can give? You have like some MRSA coverage. Somebody tell me that. Bactrim is one,
Bactrim.
doxycycline also, and clindamycin have a little bit of coverage. When somebody who come in with the cellulitis, I usually kind of treat for like 2 weeks Bactrim and Caprolax, pretty much cover everything. The community, 50% or more have like MRSA infection. So we need to worry about that MRSA infection, okay? We talk about, we'll just write it down, like, necrotizing fasciitis, right? Fasciitis, MRSA infection, or any type of infection, right? And then we have to talk about maybe like some animal bites, like cat or dog, and those kind of things.
Yes.
We'll just kind of write it down, right? Okay. So we talk about some compartment syndrome, right? What are the signs again? Somebody kind of tell me that the 5 P's one more time. Really, very, very important to know.
Pain,
Pain,
pallor,
pallor,
paresthesia,
pulselessness,
pulselessness,
and
increased
pressure,
pressure.
right? So those are the 5 things we need to know about this. And then vascular occlusion is like we need to worry about any kind of DVT,
Yes.
right? What are the common causes like upper extremity DVT, like board or examination question? If I take in the United States, if somebody come with upper extremity DVT, what's the first thing that should come to my mind? First of all, is upper extremity DVT is common in the United States? No, you usually
No.
see what? Somebody come with the leg, lower extremity DVT, right? What should I worry about, like when somebody with upper extremity, like he didn't have anything, it was like somebody in the community come in, he wasn't admitted to hospital. If it admitted to hospital, what is the most common cause of upper extremity DVT? Let's talk about that first.
Okay.
This guy was admitted in the hospital for 2 weeks, then you go home, come with an upper extremity DVT. What will be the most common cause? They usually have like a PICC line or something,
Right.
we did, and that kind of cause it, right? But let's say that some guy did not get admitted to hospital and they are like coming back all of a sudden upper extremity, always think about malignancy. Okay? So an examination question, every exam they're going to ask. Upper extremity DVT, always kind of linked to malignancy. Okay? So we just kind of say like a DVT or any kind of arterial occlusion also kind of would have something. We just have to kind of have like pain, swelling on his skin, we kind of change it. And trauma, any kind of fractures people doesn't know, and all those kind of, which fracture is associated with compartment syndrome more?
Supracondylar fracture.
Tibial fracture.
Okay.
Okay, tibial fracture is kind of related to malignancy. When I talk about malignancy, let's say you got like any kind of malignancy can contribute to DVT, and sometimes you have like cancer. They have to do, the lymphatic occlusion that can cause like swelling
Yes.
also. And kind of think about like a lymphatic obstruction, right? We can say like a lymphatic obstruction. Maybe lymphangitis, right?
Yes.
That's also we can write. Okay, did we go through all our differential? Next, so tell me about this case a little bit more.
Yes, so the patient reports the
Yeah.
day prior to admission, she
Yeah.
was scratched by one of her cats.
Okay, so now we have like, we have a source, like what happened. Now we're getting more. This patient was scratched by a cat, right? So what are the organisms we have to think? I think the bites itself, we need to know, like the main thing we need to know, is it a cat bite? Is it a dog bite, right? And then what else we need to know? Is it a human bite? Also, this is kind of all three things. So tell me, like, what are the most organism in the cat bite and the cat scratch? Is both of them different? So somebody tell me, what is the organism in cat scratch and what is the organism in cat bite?
Cat scratch is Bartonella hensley.
Okay.
And cat bite, Pasturella multocida.
Okay. Cat bite, so it's Pastorella multocida, and the other one? Bartonella hensley,
Hensley,
right?
the cat
So
bite.
those in. What about dog bite? What are the main organisms? Somebody tell me what is the main organism?
Pastorella.
Pastorella canis, and you
Right.
can call it capnocytophagia, and
Right.
also those are the pastoral. It's always kind of look at what is the most. What about human bite, right? That's also becoming like,
Yeah.
might have like somebody bit somebody or something. You see patient in the ER. Like, what is the organism?
It's
Viridian streptococci. Always kind of remember. So it's good to know which organism. So we have to kind of treatment and all that. Okay, and then anything else?
No, so she just had multiple scratches on her left wrist, thumb, and index finger,
Okay.
which was also associated with bleeding and swelling.
Okay, all right, let's go into, so we have this presentation, we already know this patient have left hand pain, redness and swelling. I was bitten by, it was like a scratch, right? Scratch is the one like term we have to use by the cat. Now, past medical history, let's go into past medical history. What are the past medical history we need to know?
This patient had breast cancer,
Breast cancer, right?
hypertension, hyperlipidemia.
Why is the breast cancer important, sir? Why is the breast cancer important to somebody with, you're talking about infection? Why is that?
Post mastectomy, there are chances of lymph node obstruction.
Yeah, you can have, but this you already know this patient have a cat scratch, right? So we can it's possible. They could have like swelling because they had like a mastectomy done, they did surgery, lymphatic obstruction, they have like swelling of the hand. But why? What else we need to know? When somebody said breast cancer, I need to know what's going on.
Patient
Why
is-
is that?
Patient is immunocompromised.
Immunocompromised, that's the word. Just because they have breast cancer doesn't mean they're immunocompromised. So what do I need to know? I need to know what stage and what treatment they have and all those kind of things, right? Are they undergoing chemotherapy? That might situation make it kind of like really kind of serious. So don't say just breast cancer. Tell me what is the stage on this patient? Like what is it? Is she undergoing any chemotherapy or anything? Do we know?
She just had her bilateral mastectomy.
When was that? Do we know when?
No.
Is it important to know?
Yes.
Okay, so this is like always get a very good history. That's why very careful, like, just don't present like breast cancer. And what stage, when was the last time she got treated? Is she on chemotherapy or any of the immunosuppressant drugs she's taking also, we need to know, right? But breast cancer, okay, what else she have? Any other history we need to know?
She just has hypertension, hyperlipidemia, hypothyroidism, asthma.
Doesn't kind of
Yeah.
help us that much,
Yeah.
right?
Yeah.
Okay, what else? Okay, now let's go to the allergies. Is it important, allergies?
Yes.
Yeah, giving like antibiotic. Most people have penicillin allergies, right? So you need to know any kind of allergy and any of this patient. Very important to know what allergies are. This patient have no allergies, right?
Yeah, she just
No.
used for cefprozil. So
What was that?
cefprozil.
Okay. And then what else? So let's talk about the family history. Anything?
No significant family history.
And then medication. What medication she's on? Why should we worry about medication, sir? Why should
She's
we?
on any chemotherapy or
Any chemotherapy or
drugs.
immunosuppressive, a lot of patients like taking steroids or any other immunosuppressive drug, we need to be kind of thing. Any important medication the
No,
patient is
sir, she's
taking?
just taking for hypertension and
Hypertension and all, that's why it's not
Yeah.
good. And now come to the social history. Why do we need to know about the social history? Right, we need to know like, what do we need to know? What is the social history? Tell me the social history at least.
The patient is single. She's never smoked in her life.
Okay, not a smoker.
She's not a smoker.
Yeah. What about alcohol? Does it use, like, do we need to know why is it alcohol is important in somebody with the cellulitis and all those kind of things? Chronic alcoholism, right?
Right.
There's like some of this infection will be like extremely worse in those situations. So chronic alcoholic patient infection, take it a little bit more seriously, okay? And then we need to know that, but this patient is not
No,
drinking
no.
and, okay. Even HIV, right? HIV we need to know, why is that? immunocompromised again. I mean, when you say like if you have HIV, I need to know what's the CD4 count. Not everybody is immunocompromised, right?
Right.
If the CD4 count is like really less than, less than like 200 or 100, then I would be like worried. Then I would say this patient have immunocompromised and all that, right? So sexual history is important. Any sexual history?
No.
Okay. Did you ask?
Yes, sir, we did.
You did ask, and the sexual history is normal. Okay,
Yes.
psych history also, for the completeness sake, we need to know,
Yes.
make sure, and all those kind of thing, right?
Yes.
When you talk about the social history, always kind of get to know the pet. Like, do we need to know what is the information we need to know about the pet?
Are they immunized?
Vaccinated.
Are they vaccinated, right?
Yeah.
If they're like, otherwise we need to usually like most of the other countries, then you have to worry about rabies. In the United States, it's very less. Which bite we need to be worried about the organism in the United States?
Bats.
Bats. Okay, once you have the bats, you have to get the rabies vaccine. But all the other things kind of like, to find out the history is less and you can, okay, anything else? So we did that. Tell me the vital signs.
Yes, sir. Blood pressure was 144/65.
144/65,
Temperature was 101.9.
101.9,
Pulse is 112.
112,
Respiratory rate was 18.
yeah,
SpO2 was 95%.
95%. Why do we need to know about the vital signs when somebody with an infection? Why is that?
Temperature.
Septic shock.
Sepsis was the
Sepsis,
first thing.
yeah.
So somebody tell me what are the criteria we're looking for sepsis, right?
Right.
Heart rate greater than what? 90.
90.
Respiratory rate greater than
20.
20, right? And the temperature greater than 100.4. So you get like three information over here which meet our sepsis criteria or SIRS criteria. Always remember that, right? 100.4. I'm just looking at this. Okay, what is the sepsis criteria come from this? Okay, what is the sepsis criteria? One, this is important, right? I'll say yes. 100.4.
Yes.
Somebody say it loud.
100.4.
Okay, what is this?
More than 90. Yes.
Heart rate
More than 90. Another criteria,
Yes.
right? Respiratory rate?
More than 20.
More than 20. Okay,
Right.
so those kind of things kind of use and all that too. Now, why is the heart rate is also important in infection? Like, why is it important in infection? What is relative bradycardia? What is that? Somebody tell me. Relative bradycardia. Usually what happens when you have fever, right?
There.
You have fever, heart rate goes up.
Yes.
Every 1 degree, I think, is supposed to go like 10
Right.
degrees centigrade. Which infections you can have temperature going up 102, heart rate going the other way. But that's called relative bradycardia, or you can say I think they Faget, F-A-G-E-T syndrome. So you need to know that. So what are the common infections can cause relative bradycardia?
Salmonella.
Salmonella, typhoid fever is kind of very common, okay? Yellow fever, then you got tularemia, brucellosis, and then you got Legionella pneumonia, mycoplasma pneumonia, and also very common to do that.
Okay.
Sometimes the board can ask you, any kind of question. Relative bradycardia, Faget syndrome, remember that.
Okay.
Okay, now what are the things we have to do? Examination, right? What examination is important?
Musculoskeletal.
Yeah, like
External.
whatever the area, we can do a
Right.
focus examination, kind of make sure, because it just happened 2-3 days ago. We're not suspecting anything else. So what are the inspection? What does it show?
Her cardiovascular, pulmonary, abdominal, everything was good.
Yeah.
Her musculoskeletal, she had swelling and tenderness of her left arm and forearm,
Swelling,
and tenderness
uh-huh,
on her left arm and forearm.
tenderness, forearm, what else?
Left arm and forearm.
Okay.
And also on the wrist, she had swelling and tenderness, and there was decreased range of motion.
Decrease range of motion. Okay, so there is redness also, right?
Yes.
Okay. What else? Are you happy with this finding or anything else we need to know?
On her skin, on skin findings, we also found that there was erythema and rash present.
Okay, there's we talk about redness and what else we need to know on the examination?
Any crepitus.
Okay, very good, because we already trying to
Yeah,
look out. Is there
infection.
bolus lesion, crepitance, kind of feel it, because it could be some endocarditis fasciitis. What else? Look at the other causes, what are the vascular insufficiency? What should we check for?
Pulse.
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 Okay, make sure there's like, because that's another emergency. So somebody tell me, what is the pulse? Is it or normal?
Yes, about
Okay, pulses, vehicle pulses and all that too. So now let's look at we did this, what are the investigations we have to do?
Yes.
Right.
CBC.
All right, let's see, like, what is the WBC count?
WBC was 21,000.
21,000, okay,
Hemoglobin was 11.9.
okay.
And platelets is 194.
Okay, platelet is 194. Okay, so we know, like, I mean, again, what is the sepsis criteria for, like, how high has to be? Again, we talk about 1, 2, 3, and the WBC count greater than 14.
Yes.
Greater than
I mean,
14.
I'm sorry, greater than 12.
12,000.
Yeah, I got it. So if it is greater than 12, so this patient, does they meet the sepsis criteria?
Yes.
Okay, because we know at least, like, I mean, only 2 you need, and you need a source. There's like a bite. This patient is like sepsis, right? We need to worry about sepsis in this patient. So, labs. What labs are important to you? Anything?
No, so everything was normal.
Okay. Why is this bicarbonate is important to you?
Yes.
Why is that? Metabolic acidosis. Why is it important?
Because it can be lactic acidosis.
Lactic acidosis, you have to be careful, right? And then we need to know the renal function and all those kind of things. Everything
Yes.
was pretty normal.
Yes, sir.
Okay,
Yes.
so always gotta pay attention to metabolic acidosis and all that too. What are the lab tests you wanted to do on this patient? You have to look for any bandemia, right?
Yes.
Was there any bandemia? Left shift, those kind of things is
Right.
important. Okay, what else? What are the lab tests? Do you need a CRP,
Yes.
right?
Yes,
What is the
sir.
CRP in this patient or ESR? They didn't check? Okay, let's move on. Like, did they do lactic acid at least? Not either?
No.
It's a crime, right? If you don't check these people for lactic acid and all those kind of things, right? So make sure those kind of things and all that too. So what's the next step in this patient investigation? What are the next step in the investigation we have to do? So we did this, we did the lab, we have to check for CRP, we did the ESR, we did the lactic acid. Let's say, I mean, we have to check order that. What are the next investigations we have to do? What kind of imaging would you do, and why? What are you looking for in the imaging?
X-ray.
X-ray, what are you looking for?
Any fracture or any.
Okay, but we already
osteomyelitis.
know, like, I mean, this person that doesn't, have fractures, it'll like cat bit him and all that, or cat scratch, right? What are the other, why do we get an X-ray? What are you looking for in there?
Mets.
Huh? Mets?
Oh,
Okay,
No, we
all
can't
of a
say
sudden,
extra.
I mean, all of a sudden, like, I know you're like breast cancer, right? I mean, you have the Mets in the region and all that too, but we looking for air, right? Necrotizing fasciitis, gas, gangrene, like air in the soft tissue.
Okay.
Then you have to be look very serious, kind of taken and all that too. So that's what pretty much I'm kind of rolling it out in this patient. Okay. So any other questions on this? Okay. So let's come to assessment and plan. What is the number one? What is our number one diagnosis? We can say
Cellulitis.
cellulitis. So you will say, what is it, left arm?
Yes.
Yes.
Okay, we can give a term, left arm cellulitis. Due to what?
Cat scratch.
Cat scratch, right? Cat scratch. Okay, and then what else I would write? What is the next thing I should write? Come on, what is this? SSS, I said so many
Sepsis.
times.
Sepsis.
You meet the sepsis criteria,
Yes.
right? The sepsis criteria that make it more sepsis criteria, right? I write sepsis criteria met. What else I need to do? What investigations I have to do? Let's do I gave my diagnosis. I also tell them how strong my diagnosis is, right? And what is the next thing? What other anything we have to check?
Blood culture.
Blood cultures. I will check a blood culture. All right. Any other? Do you need to do any
Serology.
antibodies on like a serological test?
Right.
What test would you do, and why should we do it? You already know this is in this patient, right? You have like IgG and Bartonella. You can check for IgG and IgM. But in this case, I already know. Like, I mean, it happened. There's a guy. I would not. But it's a pretty. If you're like suspicious of this, what it is. because sometimes cat scratch can have like a long incubation period, like 21 days, and then you kind of use this IgG or IgM because sensitivity is pretty high on that. In this patient, I would not do because I know this is already like a cat scratch happened here, an infection. It's not going to make my management. What is the antibiotic choice? Azithromycin, right?
Yes.
You start the patient on IV azithromycin. And the next thing you have to do is once you did the blood culture, you got like IV azithromycin, it was kind of started. And do we need an infectious disease consult in this patient?
Yes.
Why is that? What are they going to do different on that? Before you put a consult, I always ask what difference, what are you going to do different than the other consultant is going to do, right? Right now, I know what are the investigations, antibiotic need to be treated and all those kind of things, right? Anything else we have to do? I think we covered everything. Make sure you check the lactic acid, right? We need to make sure this patient doesn't have cellulitis, have necrotis and fasciitis, LRNE-IC score, okay? That also I would just kind of calculate it out, okay? Thank you so much.